I'm very proud to sponsor Dr. John Lubicky as a pillar in orthopedics in our AOA recognition efforts. Dr. Lubicky is known nationally and internationally primarily for scoliosis work over decades, but also for his work in pediatric orthopedics. John came to us here at West Virginia University about 10 years ago and really took our program to another level. He is a tireless worker, highly skilled, and one of the best educators I've had the pleasure to work with. I think those people who know him would perhaps describe John as a lovable curmudgeon who has won teaching awards and is beloved by the residents and highly respected by his partners. It's really my honor to present him as a pillar of orthopedics, a recognition well deserved.
I'm Dr. John Lubicky. I'm professor of orthopedic surgery and pediatrics at West Virginia University School of Medicine, and I'm chief of pediatric orthopedics at WVU Medicine in Morgantown, West Virginia. I became a member of the AOA in 1993, and I was accepted as a member on the first try, and I really felt that that was a tremendous honor, and it signified a certain amount of accomplishment in academic orthopedics, meaning that members had to have had demonstrated a significant work in teaching, research, and publications. To tell you the truth, when I became a member, I thought to myself, I've really made it now. And so for me, this has always been a very important milestone in my career, and being a member of the AOA is certainly something that I am very proud of and I cherish. I think for me, the biggest contribution that I've made is the teaching of so many fellows and residents over the last 40 years. And the end of June every year for me is a sort of bittersweet time. It's sort of sad, but it's sort of happy too. It's sad because we're losing a group of people that that had become part of our family for 5 years. And this is one of the fulfilling things about teaching, is that some guy shows up as a green intern, knows nothing, can't do anything, but by the end of that 5th year, he or she has become a competent orthopedic surgeon. And it's good to know that I played at least some part in producing that orthopedic surgeon. You know, it's a pretty nice feeling when former students call and still ask for advice about cases and things like that. I've really had a great ride in orthopedic surgery, especially in my main area of interest, which has been spinal deformity. The two men that were most important to me were Dr. Ed Miller, who just recently died, who was my boss in my pediatric fellowship, and Dr. Ron DeWald, who was my spine fellowship director. And they set me up for success when I did those fellowships in Chicago. Being a member of the AOA is sort of the cherry on top of a successful career in academic orthopedic surgery. About 6 months or so ago, Sandy Emery, my chairman, came to my office and he asked me if he could talk to me. And he brought up this idea of being a pillar of orthopedics. And basically I said to him, "What, are you kidding? I'm not I'm not of the caliber of the people that have already been named pillars. Like, as it turned out, you know, he contacted a number of my former colleagues and students, you know, former residents, fellows, partners at the other places I've been at, and the response was just overwhelming. And it's a humbling thing to think that these people feel that good about you that they would donate for this award. And so I'm really thankful to everybody that participated. And again, it's really a humbling thing to consider.